Welcome back for another radclusive videos. Today, we're going to discuss everything you need to know about gout. Before we proceed to this video, don't forget to click the like button, share to your friends, subscribe to Earlyseven YouTube channel, and click the bell icon for more radclusive videos. Gout is a common type of arthritis that causes intense pain, swelling, and stiffness in the joints. It usually affects the joint at the base of the big toe, known as the metatarsophalangeal joint. Its main cause is the presence of too much uric acid in the body. Gout attacks can come on quickly and may keep recurring over time. This ongoing resurgence can slowly harm tissue in the inflammation area and can be extremely painful. Hypertension, cardiovascular conditions, and obesity are risk factors for gout. Hyperuricemia, where there is too much uric acid in the body, is the main cause of gout. People will typically treat the condition with prescription medication. These drugs can help treat the symptoms of gout attacks, prevent future flares, and reduce the risk of complications such as kidney stones and typhi. Typhi refers to when acid crystals form masses of white growths that develop around the affected areas. What are the causes of gout? Hyperuricemia, an excess of uric acid in the blood, is the leading cause of gout. The body produces uric acid during the breakdown of purines. These are chemical compounds found in high amounts in certain foods, such as meat, poultry, and seafood. Typically, uric acid is dissolved in the blood and excreted from the body in urine via the kidneys. If a person produces too much uric acid or does not excrete enough, it can build up and form needle-like crystals. These trigger inflammation and pain in the joints and surrounding tissue. What are the types of gout? There are various stages through which gout progresses. These are the following. 1. Asymptomatic hyperuricemia. A person can have elevated uric acid levels without any outward symptoms. While individuals do not need treatment at this stage, high uric acid levels in the blood can cause silent tissue damage. As a result, a doctor may advise a person with high uric acid levels to address factors possibly contributing to its buildup. 2. Acute gout. This stage occurs when uric crystals in a joint suddenly cause acute inflammation and intense pain. This sudden attack is a flare and may last between 3 days and 2 weeks. Stressful live events and excessive alcohol consumption could be contributors to flare-ups. 3. Interval or intercritical gout. This stage is the period in between attacks of acute gout. As a person's gout progresses, these intervals become shorter. Between these periods, uric crystals may continue to build up in tissue. 4. Chronic tophaceous gout. Chronic tophaceous gout is the most debilitating type of gout and may result in permanent damage to the joints and the kidneys. At this stage, people can have chronic arthritis and develop typhi in cooler areas of the body, such as the joints of the fingers. Chronic tophaceous gout typically occurs after many years of acute gout attacks. However, it is unlikely that individuals who receive proper treatment progress to this stage. And 5. Pseudo-gout. One condition that experts easily confuse with gout is calcium pyrophosphate deposition, known as pseudo-gout. The symptoms of pseudo-gout are very similar to those of gout, although the flare-ups are usually less severe. The major difference between gout and pseudo-gout is that the joints are irritated by calcium pyrophosphate crystals rather than uric crystals. Pseudo-gout requires different treatments than gout. What are the risk factors for gout? Several factors can increase the likelihood of hyperuricemia and gout, including age, sex, genetics, lifestyle choices, lead exposure, medications, weight, and other health conditions. What are the symptoms of gout? The main symptom of gout is intense joint pain that subsides to discomfort, inflammation, and redness. The condition frequently affects the base of the big toe, but can also occur in the forefoot, ankles, knees, elbows, wrists, and fingers. Test and diagnosis. Gout can often be challenging to diagnose, as its symptoms are similar to those of other conditions. High levels of uric acid in an individual's blood, or uric crystals in their joint fluid, are the main diagnostic criteria for gout. To assess this, a rheumatologist will carry out a blood test and may also extract fluid from an affected joint for analysis. In addition, they can search for uric crystals around joints or within growths using an ultrasound scan. X-rays cannot detect gout, but healthcare professionals may use them to rule out other causes. As joint infections can also cause similar symptoms to gout, doctors can look for bacteria when carrying out a joint fluid test to rule out a bacterial cause. A doctor will typically recommend prescription medications to treat gout. This may include treatments to reduce inflammation in the affected joints and drugs to help regulate uric acid levels. People can help reduce their risk of developing gout by avoiding foods high in purines that the body converts into uric acid, keeping adequately hydrated, and avoiding alcohol. That's all for today. Until next time, if you enjoy watching this video, don't forget to click the like button, share to your friends, and subscribe to Earlyseven YouTube channel for more radclusive videos.